Hi, I'm Dr. Cale Goldfarb with Water and Sports Physical Therapy. This is Dr. C.J. Regala, one of our orthopedic physical therapists. We're here today to talk about the differentiation of back pain. In this season, when we're increasing our sports activity during the summer, a lot of our patients tend to get low back pain. They're not sure if it's a back strain or a disc problem. So we're going to go with some basic techniques to see if it is a back strain, meaning you either strain your muscles or sprain your ligaments, versus a disc issue. So first, let's look at the back and the spine to see what we're talking about. The muscles surround the spine, and they, with overwork or over tension, can actually get tensioned and cause small micro tears and go into a guarded position. That might be a muscle strain. You can also sprain the ligaments that attach from one joint to the next. The other issue we're talking about, which is more serious and can continue to get worse with time if it keeps happening, is a disc injury. These are shock-absorbing discs in between each vertebra in the spine. Both injuries can occur in the same position. So Dr. CJ is going to stand up here, and I'll show you the position most likely to get injured in. You'd be in a flexed, rotated, and side-bent position. If CJ were to bend forward and grab something off the ground, this is usually the area where you actually strain a muscle or pull on your disc. You go this direction or the other direction. If he were to bend his knees, he'd have less pressure on his back, but typically we don't control the motion like we want to, so the extra pressure is put in the discs, ligaments, and muscles. So if he gets up and he feels a sharp back pain, we want to decide if his problem is muscle, ligament, or disc. Very difficult to decide on your own, but I'll give you a couple quick tips to see if you can differentiate it in a quick minute. So, first test we do is called a slump test. CJ's going to sit down here, and the first thing to do is going to slump down into a bad postural position. When he slumps, he's going to go down this position. What that does is it increases the pressure on the back of the discs. It doesn't differentiate whether you're pressuring the disc or possibly tensioning the ligaments or muscles. But it's important to know that just that position alone can affect all three. So if this starts your pain, that tells us something's going on in the back. That could be a tensioning issue. Then what we're going to do is lift up one leg, straighten one knee out. What we're doing is we're now pulling on the nerves that move along the spine and through or pass by the discs. Then we're going to pull his toe up toward his face. This increases the tension on the nerves even further. So his toe's pulled up, his head's pushed down, and what that would do is that would increase his pain either down the leg or in his back. If we wanted to see if nerve was not involved and disc was not involved, if he points his toe down or picks his head up to the ceiling, that would relieve his symptoms. So the key is, if this increases your pain, you need to see a physician or an orthopedic physical therapist pretty quickly. Because even if this problem gets better, it can come back worse the next time. Your disc can go from a bulging disc to a ruptured discs. Another sign you want to look for is numbness and tingling in the feet or legs. You want to make sure you don't have this. That's a sign of a nerve root compression. You want to make sure you don't have loss of bowel or bladder control or numbness in your saddle region, your inner groin region. If those things are present, you need to see a physician immediately. Otherwise, if it's local back pain or pain down the leg, what people call sciatica, you need to differentiate whether it's from the sciatic nerve getting pinched in the pelvis or from your back. Commonly, people miss this and it's actually coming from the back and the spine, and a disc bulges and puts pressure on the nerve. If you don't catch this, the next time you injure it, it could be worse and rupture, and then you have a disc prolapse or rupture, which causes more damage. So make sure you treat this gingerly. Rest in the beginning. Try to get some good medical advice. If you have any questions, please feel free to call us at Water and Sports Physical Therapy.